As the thoracic oncology nurse navigator, I'm one of the first people that patients and families meet. It's a very overwhelming time. They get a lot of information and they're often very scared. And so I'm one of the first people during their consults. I provide a lot of education, and I feel very strongly and I listen very closely to patients, because I think shared decision making is very important. One thing that we are really seeing lately is, everybody knows what chemotherapy is. Everybody's had an experience, a family member, a friend, and I often hear, "Oh no, I don't want to do chemotherapy." And so our medical oncologists are listening, and even though they feel that a combo of chemotherapy and a immunotherapy would be the best, they are often taking into consideration what the patient and the family want, and offering just the immunotherapy. Just today I had a patient that was adamant she was not going to do any chemotherapy. In the shared decision-making conversation that the doctor had with the patient and her daughter, we came up with a solution that, we do the Ipi-Nivo, and she seemed very agreeable to that. So I think shared decision-making is very important, but we have to listen to what our patients and what the family is saying. And I think what helps in their shared decision making is the fact, in the time that we're waiting for the next generation sequencing, the patient and their family often I call them, and I reinforce, why are we waiting these 2 weeks? And I go over and over again with them that, remember, we're waiting for the molecular testing, and that helps them make that decision as well.
One of the first questions that I get from my patients is, am I going to die? They then may ask me, what kind of treatment can I really get? Even though the physician may have just had given them that information, I may be phone calling and following up with them, but they are still pretty much frightened over their diagnosis, and they literally can't recall what their diagnosis specifically is or what the treatment options are. So I usually am able to gently review with them what their exact type of non-small cell lung cancer that they have, and then remind them, that we do have a few different options for them. They can have chemotherapy, and I actually explain how it works. Chemotherapy is going to kill the cancer cell. It'll have some side effects that it kills the healthy cell. Immunotherapy is going to trigger your body to fight the cancer on its own. And targeted therapy is going to just target a specific protein on the outside of the cancer cell to interrupt its growth so that it can then kill the cancer. So I give them just a general overview of the three, and then proceed from there.